Hi, I'm Manjot Gill. I'm a professor of ophthalmology and medical education in the Department of Ophthalmology at the Feinberg School of Medicine. I'm also the vice chair for patient quality, safety, and clinical performance. Another area of my research focuses on leveraging the power of the retina to determine human aging. We looked at fundus images in a population of the Swiss Amish community that harbor increased incidence of the PI1 mutation, which confers protection against aging. We looked at fundus images in these patients and used an AI model to estimate cardiovascular risk. And what we did find is that in members of the population that did harbor the mutation, the retinal imaging did allow us to detect those who had a greater cardiovascular risk, and we were able to correlate many of the findings on retinal imaging with their increased systemic risk for cardiovascular disease. So again, this demonstrates the power of using the retina in order to assess for both longevity and risk for cardiovascular disease. I was also pleased to report on a subgroup analysis of patients from the PHOTON trial, which investigated 8 milligrams of aflibercept in the treatment of diabetic macular edema. And what we found was that in patients who had had prior treatment for DME, that patients who were randomized to the 8 milligram Q16 arm had slightly decrease in their best corrected visual acuity outcomes. And this likely suggests that this patient population could have benefited from more frequent treatment injections. So overall, these results are reassuring in that we do see that patients who have prior DME treatment still benefit from 8 milligram treatment with aflibercept, and perhaps those that were treated less frequently could have benefited from more frequent treatment injections.